podcast. We're going to be covering a whole lot of awesome information. You guys get pumped for this. We actually have a giveaway today. We're going to be giving away a superfood drink. We'll be giving you information on how you can get involved in that. But I want to kick off this podcast with something that you're probably not aware of. Okay, this is not widely talked about in the medical industry. Um, it's not widely known in the medical industry. However, Tanya, who is my co-host and far more intelligent than I am, and also she's a nurse and has many other qualifications within the medical field. I'm a fully qualified personal trainer. It's just a few steps down the ladder. Well, actually, it's right at the bottom of the ladder compared to her qualifications. But I'm going to hand it over to Tanya. And she's going to talk a little bit about this cancer treatment and the amazing technological advances that we are now making in regards to treating cancer.
Yeah, thanks, David. I really appreciate that. So in regards to, I appreciate just the opportunity to help others and to encourage other people tonight or today. I just wanted to talk about a little bit about just some of the things that I've seen within working in oncology with different patients. I work currently at the James Hospital in Columbus, Ohio. It's a leading research institute where we actually develop breakthroughs in cancer research. So I see a lot of things, and one of those things would be in regards to cancer patients. I work with ear, nose, and throat patients, and I also work in neurosurgery. So I work with brain tumor patients, and I also work with mandibular cancers, those types of things. So what we see, I think people need to be aware of, just for the fact of, clinically speaking, there is a wide spread of STDs worldwide, but especially in America. And so the STD I want to talk about specifically is called HPV, the human papillomavirus. So I don't think it's that well known in our population. It's becoming an increasing awareness that HPV is actually a virus within the human body. If it's caught, it's normally sexually transmitted, and it's currently within a good. The percentage would be about 70% of people within the U.S. And so some of these people, obviously, they're going from partner to partner, and they don't even know that they carry that virus. So the way that it can be detected would be through what's called genital warts, which comes up, but it actually can be misdiagnosed because there can be loose skin tags as well. So that's a difference. So people typically, that's misdiagnosed there. The thing with this, if it's not detected, it can actually cause squamous cell carcinoma, which SCC carcinoma, of the mouth and of the oral pharynx. And what that means is through oral sex. So we see a high percentage of patients that actually are diagnosed in the late stages of this, because that virus can linger in your body 10 to 30 years, and if it's undiagnosed, then it can actually spread, and it can actually decrease the immune system. It breaks it down. Tumors can develop, and then and that person has no idea that that's going on. So that's important, for people to know.
So okay, let's say a tumor develops, and obviously you said this is STD, so it's transmitted through sex, unprotected sex and dangerous sex. Once the tumor evolves, what is the treatment? What do they actually have to do? Because I believe you mentioned it's viral. So
It
how
is.
do you treat this?
It is. So it is a viral STD, the HPV, which now the new vaccine has come out, and so typically within the medical field, we're pushing for the vaccine, and there's been some diversity. There's been some arguments within, about that as well. I don't have time to go into the clinical research right now in regards to the effectiveness of the HPV vaccine, but people can look at it, and I'm more than ready to answer questions for people in regards to what to look for, signs and symptoms,
Yeah.
those types of things, and can actually help people with that.
Okay.
I can actually get connected to appropriate resources if they need treatment. I'd be more than happy to do that as well.
Okay.
But as far as treatment's concerned, it needs to be caught. So the vaccine is typically given to young teenagers or preteens. And that has seemed to be quite effective to decreasing the spread of the HPV virus itself. But so that's one way for prevention. Obviously, safe sex would be another one, or abstinence, depending on your belief system and those types of things. But if a person does have HPV, it's not detected, and a tumor were to develop or cancer does evolve, then what they would do, because typically they would have tenderness, they'd feel lymph nodes that are swollen. I think for the ear, nose, and throat population, for anyone experiencing that, if you do feel a swelling of your lymph nodes, whether on the right side or the left side, or if it's extreme tenderness, that would be a high indication you do need to get that checked. Another thing would be increased redness or inflammation in the throat, or in the tonsil area. If that continues to go on and it's not relieved, that needs to be checked. And those type, even there can be obstructions that occur from tumors, shortness of breath, those types of things.
Okay.
If that needs to be checked.
Yep.
So, in the treatment, as far as that's concerned, if there is a tumor that develops, then, obviously scans would be done, staging would be done, to indicate the type of cancer. A biopsy would probably be done, and once that biopsy comes back and the type of cell is diagnosed, typically SCC, squamous cell carcinoma, but it could be a different form of cancer cell.
Sure.
Depending on different cancer cell or that type, then there are certain protocols that would be taken, such as maybe surgical or chemotherapy or even radiation. Does that answer your question?
Absolutely. And look, I think a lot of people are saying they're bored in the chat room, but the point is this. I've seen 3 people in my family die of cancer now. I hate cancer. And I can't tell you how important it is, and what Tanya's talking about here is groundbreaking in the detection of this particular cancer and cancer in general. I cannot tell you how important it is to get checkups. And to not get checkups with your GP, but look at what else is available as far as cutting-edge technology is concerned in, getting away from cancer. And let's just be honest. We live in a world where we all have sex. Who really is practicing abstinence? That's something that existed in, 1850. So this is an STD. It gets passed on through an STD, and it generates into cancer, which is a pretty serious matter. So, again, any of these symptoms or signs, and Tanya has described that, and you can watch the video back. Get yourself checked out. It definitely, I'll tell you, I've seen people lying on their deathbed, completely just their bodies breaking down, wishing they were dead from cancer. You want to stop it in its tracks. All right,
Right, right.
guys. I'm gonna move. We're gonna move from that, and I want to flow here and talk a little bit about protein intake to build muscle. Okay, because I know a lot of you guys and girls are interested in, you know, on the Instagram there, and also on YouTube and the other platforms we've got. One of the biggest questions that people have is how much protein do I need to build muscle? Okay. Now, I don't believe that this is exclusively the same for everyone. And there are a lot of factors that are going to contribute to how much protein you're actually going to need to build muscle. Now, the first thing is you're going to need to train. Okay, so you're going some form of resistance training. Okay, before you build the muscle, and we're going to talk about low volume versus high volume for building size. All right. But either way, there has to be progressive overload, consistency, and training. So what do you do after you train? And a lot of people say a lot of people, they'll grab that protein shake and they'll take that protein shake. But the question is, do you take the isolated version? You know, do you take a slower acting version? And here's the reality with those protein shakes: your body can only absorb so much protein at a particular time. You can prime your body to absorb more protein through intermittent fasting, which we're going to talk about, and timed eating. Okay, your protein synthesis levels can be increased through supplementation, all right, or through increasing your testosterone through whatever it means you do that through. You know, some kind of testosterone-based supplement. Um, Intermittent fasting also will alongside training make your body just absorb that protein. It just wants to eat that protein up like building blocks. All right.
Mm-hmm.
Now, I don't need that much protein to grow. Okay. Literally, I don't need that much protein to grow. The standard rule, scientifically speaking, and I looked at 5 different studies on this, and we had to look at this when we were doing personal training, all right? And I'll talk about, you know, how it is practical to some of the clients that I've trained and some of the people that I've talked to and for myself, but for each body pound that you have, you want to be consuming 1 gram of protein. Okay, 1 gram of protein. So if you weigh 200 pounds, you want to be getting 200 pounds of protein in a day. How do you do that in timed eating? You know, if you're fasting, you know, how do you do that in a short period of time? Well, you can do it. It's possible to do it, but it's all about preparation, and it's all about adaptation and letting your body adapt to it. Now, there are other studies that are done, okay? And listen, the Australian Olympic team only gives their athletes 0.7 grams of protein per kilogram. And there are 2.2 pounds in a kilogram. That is a very low amount of protein. And I find that when I eat tons and tons of protein, my body does not use it all. And I'll probably be on some kind of hardcore, let's call it a supplement, you know, that increases protein synthesis. We are pro supplement here. Pro, get that testosterone in your body. If you're over the age of 30, your testosterone is already too low. Your libido is already too low. Your human growth hormone levels are already too low. You need to do something about it. Get to your TRT doctor, or go on our YouTube channel and have a look at the 4-DHEA product that I did a review on, and get some exterior testosterone into your body. Don't turn into a woman when you're 30. There are too many limp-wristed men out there that, you know, I mean, you can feel like you're 20 still. We have come far, TRT. You know, we have come far too far in supplementation and understanding to age. There's no excuse to age anymore, okay? No excuse to be at your best, to be feeling like you did when you were 25. Point is, we're talking about protein, and we're talking about, do you need protein shakes? Just remember, supplements are supplements. Food is way better digested than protein shakes, okay? With the protein shake, especially the ones that absorb quickly, your body doesn't even have as it absorbs, it doesn't have time to actually get all the protein inside. You know what I'm saying? There are differences between the concentrate and isolate, but
Yeah.
it doesn't have time to actually absorb all that protein. So food is always better. And you have to understand, it's not just carbohydrates, excess carbohydrates that turn to fat. Excess protein also turns to fat. It's better to have a high fat, medium protein diet, low carbohydrate diet than it is to have high carb, high fat, high protein. All right. So for those of you swole, for those of you bros who want to get big and swole and want to bench press the planet, the last thing that you want. There are two things you don't want. The first thing is, we'll cross a little over into supplements. If you are getting a little estrogenic, you want to get an estrogen inhibitor, suicide inhibitor. The way that works on a pharmaceutical level, it literally is like little knives destroying little estrogenic bits and pieces inside your body. All right, and it keeps your testosterone levels up. I've lost track of what I was saying.
So
But
David,
the second thing is, you do not want to get fat when you're bulking. There is no such thing called a dirty bulk. Sorry. Have a cheat meal here and there. But who wants to see a 25% fat guy with muscle underneath walking around? We don't want to see that. You are going to gain some fat as you gain muscle. It's impossible not to. But there are going to be times, but you want to minimize that, and at the end of it, there are supplements and other things and diet that you can clean those, that little bit of fat that you gained up, and you can clean it up. And when it comes to women, you're going to need less protein than that, okay? 0.5 grams per pound, 0.7 would be more the number you'd be looking at as far as recovery and building muscle. And let me just for the sake of getting rid of this whole mentality that if I'm a woman and I work out, I'm going to look like Ronnie Coleman, who's a bodybuilder, I'm going to look like Arnold Schwarzenegger. You don't have enough testosterone in your body to look like that. There's a difference. There's a reason why when you watch the UFC, the women look a certain way and the men look a certain way. Doesn't mean the women aren't strong and powerful. Doesn't mean you can't be a strong, powerful, physically, machine-like woman. It just means you can lift heavy weights, but you're not going to get massively big bulk muscles. Tanya, what were you going to say? I didn't mean to talk over you.
It's okay. I appreciate that. So I do have a question here in regards to testosterone versus testosterone. Like you were, the testosterone. Can you explain to us what's the difference and how that fits?
There is a product. There is a research chemical called trestellone. Okay, now there is a supplement company called Olympus Labs that created a product that was transdermal. It was called trestellone. And it was a test base. It was perfectly legal. Okay, so we weren't taking a 23-inch gauge needle, shoving it in our ass, and injecting testosterone. You know what I'm saying? That was made in a bathtub in Mexico. Now, with the positive thing about the trestellone was that it wouldn't, and the positive thing was it would just adapt to the androgen receptor. For those of you that know about steroids, trestellone has the same androgenic and anabolic ratio. It actually has a higher one than trenbolone, which is commonly known as the most powerful injectable steroid that there is. Okay, so trestellone does that. Now I'm going to tell you, I have naturally low testosterone levels, so I'm on TRT. Plus I take other supplements and do this and do that. I don't care if you judge me, whatever, that's my thing. I won't judge you for what you do. But here's the point. Trestellone does not come with the rage that Tren comes with. It does sometimes give you night sweats, and the biggest plus is that it just binds to the androgen receptor. So what is the difference between that and testosterone? Testosterone binds to every receptor in the body. And the main one that we need to be worried about is when it starts binding to the prostate. That's when prostate cancer starts, alright? And that's when people run into trouble. So now, Olympus Labs, the FDA is really dumb. Okay, sorry to say it. I think it's TGA in Australia, it's a supplement company in Australia, is really, really, really dumb. Dumber than the FDA in America. As a result of this, Olympus Labs are now starting to look to ban the testosterone product. They're not making it anymore. However, you can still get your hands on it legally as a research chemical and say that you're going to use it on your dog. Okay, but you're going to have to look at how you brew that yourself. Okay, so you can still get the powder from China, and there are other products out there. You can get it in pill form, but keep in mind the testosterone pill form, it only has a 1 hour lifespan. Okay, it's great for aggression. It's like if you're about to do a workout, it's a great pre-workout. Okay, it's great for that. It's kind of like check drops. For those of you steroid junkies who know what check drops are, check drops are the ones that the powerlifters, in the UFC fighters take before they fight because it makes them ultra aggressive, and they can kill you at the same time. Testosterone pills do the same thing, but the transdermal version or the injectable version with the long-acting ester is a testosterone base. It has all the same thing, like it will keep your libido up. It will make you feel great. It has a positive effect on the brain. Okay, it mimics testosterone. It literally, again, the world is going up. Okay, I understand God created us with testosterone, but we are making medical understandings and medical improvements on the way that hormones are used in men, and as far as testosterone being used in women, you do not want to go over. I would not recommend it for women, but for men, this is something you would want to look into. Okay, there was a website that was well known on YouTube. All right, and I'm going to name them. I love Tony Huge, and some of you on YouTube will know who he is. But he was selling an injectable fast-acting ester version on his website. The FDA told him he had to stop it. All right. Now, what happens? So what happens when they start to ban the testosterone is everybody turns back to the black market and buys the testosterone. Okay, that's why it's stupid. That's why it's stupid. Now, in saying that, there is hope. The 4-DHEA product that I reviewed on the YouTube channel, and I've also done a small review here on the Instagram, that particular product is effective, but it's still testosterone. Okay, I've switched, but so that means it is going to bind to your prostate. It's going to bind other things. It means you're going to have to get blood work done. However, if you take 3 caps of that a day, I know it says 2, but it's underdosed. If you take 3 caps of that a day, your testosterone you're putting exterior testosterone into your body. It's going to go up through the roof, and to tie it in with protein, your body is going to be able to synthesize or use far more protein to build far bigger muscles than if you were just using your own natural testosterone levels. Most men have low testosterone. In fact, most marriages break up because of lack of intimacy, because most men lose their libido by the time they're 35. All right, they need to be on TRT, testosterone replacement therapy. You can get a doctor to do that, or you can look at the 4-DHEA product, Blackstone Labs Brutal Force, or Steel Caps 4AD, or Steel Cuts 4AD, a 4-DHEA, something like that converts to testosterone, alright? There is no excuse, though, for you to lose your libido, for you to not be alpha anymore, to not have that motivation to go to the gym, do Brazilian Jiu-Jitsu, if that's what you do Muay Thai, whatever it is that you used to like doing in your 20s, it's because your testosterone levels were high. There's no reason to lose that, and you'll keep your missus happy, always. And not only that, low testosterone makes men agitated, angry, irritable, and also you'll grow a pair of breasts because estrogen will start to dominate. Okay, so you not grow a nice pair of man boobs. You buy a bra for that. And so, for you to function even in the workplace at your best, your testosterone levels need to be high. And I would suggest the TRT generally is underdosed. You need to be taking at least 250 milligrams of testosterone a week. So you need to find a real TRT doctor that you can that will negotiate with you on the amount of testosterone that he is willing or she is willing to give you. Okay, and another thing that I would like to say and touch on while we're talking about testosterone is women have a massive deficiency in testosterone. I'm telling you, there are a lot of middle-aged women out there, and even young women. You need to go and get your blood levels checked. Don't go to your GP. Even an endocrinologist, go to a health specialist, a health clinic, where they actually think outside of the square and know something that is practical, not just textbook-based, and get your levels checked, all right? Because there's a lot of women that don't have testosterone in their body, okay? But obviously the amount is far, far less than men. So if it's 250 meg for men, I believe, we're talking 8 to 10 meg for women. That's the end of my rant on testosterone.
No, I think it was really good points, and I really appreciate the fact where you brought in as far as seeing a specialist. I think that's really, really important because some people, they don't get the right kind of treatment because they don't go to the right kind of physician. So in regards to seeing a specialist, I think that's important, especially for those specific needs. And especially when you were talking about sex and testosterone and that type of thing, that is a very real issue for couples. And it needs to be addressed with TLC. And they could also go see like a sexual therapist as well. That would help. I know couples that have done that. They have gotten treated, and they're in happy marriages. But those things are definitely real issues. So if they are struggling, or if they do feel like they need that kind of special attention and care, then I would definitely advise them to go and seek out a specialist for that, for sure.
Absolutely. Very, very, very good point. Might move back into some more of the science here. It all goes together, okay? Our body, it's one thing to build muscle. It's another thing to keep your body healthy. Tanya, I want to ask you...
Yeah.
I want to ask you about thyroid, okay? This is a big one, okay? People talk about, adrenal fatigue. They talk about thyroid problems. Can you talk to us about signs of hypothyroidism, signs of, issues with the thyroid, what can be done? Fill us in.
Yeah, absolutely. So currently I told everyone that, I work in cancer and oncology, but I've been a healthcare professional for about 23 years. I've done international health. I've taught, I've educated in university. I've done different things. So based on my knowledge base and based on just practical, seeing people, everyday people, day in, day out, sometimes, they'll have symptoms as just as minute as chills or shivering or flushing or, those types of things. Their hair becomes brittle. And all these things, you need to know your body. You need to know, especially for women, I feel like it's very important, even as, you're in your 20s, you have different issues than when you were in your 30s or in your 40s. So you need to be very aware of who you are and your body. Hyperthyroidism, of course, that there's, with each one, hyper and hypo, of course you're going to have weight loss, you're going to have weight gain, you're going to go through different things. But if you find yourself that you're gaining weight, and here's women get very frustrated with this, and I know a few myself, that they're gaining weight, and they just can't lose it, and they don't know what they're doing wrong. And then they get very frustrated. They get burnt out on diet plans. They've even gone to see a personal trainer. But what is missing is sometimes it is a very physiological thing that's going on. And it does typically run back to their thyroid. Their metabolism gets out of joint. It's not working properly. And those things can be overlooked. So if you're going to, I know, David, you would recommend in your personal training that, obviously we would get blood work first. You would go from there. I think that would be very important, because if there is a physiological issue going on, then it can be detected early, and then you can build a plan from that place. So if that is an issue and the blood work, your TS, your levels come back elevated or decreased, then at that point, there is specific treatment that we would implement from there. But and sometimes people are diagnosed with cancer, so a thyroidectomy has to be, they have to go through a thyroidectomy, which is removal of the thyroid, and then you have to have calcium replacements. You have to have, different treatments like that. So all I'm suggesting is, if you find yourself, whether you're male or female, and you feel like you're just doing everything you can't lose weight, there just might be a physiological issue going on underneath that needs to be closely looked at. There might be a disease process there that might be developing that needs to be looked at and treated.
Absolutely. I want to ask you a question. I want to ask you two questions. First question is, in the bodybuilding world, there is a fad, and it's been around now for quite some time, and obviously the thyroid creates T4 and T3 hormones,
Right.
which, look, I don't know all the scientific facts behind it, but I do know that T3 burns fat. What do you think about bodybuilders or people using exterior T3, synthetic T3, as a means of a fat burner, and what are the risks of that?
Yeah, so I knew these questions would come up. So my thing is this, is if you can do all natural, or if you can do as close to natural as possible, because of the breakdown of how that's going to affect your body, then I would suggest doing it that way. If there's any way that you can do anything as close to being natural and organic and a natural breakdown in your body, it's better on your kidneys, it's better for your liver, it's better, all those pharmacokinetics of how that breaks down in your body, that needs to be looked at. But I would say the more natural, the better. As far as that specific question in regards to, I would have to research that just a little bit more, just to be honest. Yeah. And look into that a little further. But my suggestion would be to collaborate with a personal trainer like yourself, a healthcare professional, and get a good team of people around you and work together to collaborate on an excellent plan like that. Sometimes, people can try things on their own, and we do, but I think that it's best to work with a healthcare professional who's going to work with you. I know of a couple of MDs here in this area that actually run extensive blood work. They're more homeopathic, all natural, and I feel like, personally, you have to look at the whole. You have to look at the whole person. You have to look at their diet. You have to look at their sleep patterns, their water intake, their emotional health, all of it. Because we are we're not just compartmentalized as people, right?
Sure.
We are. No, you can't do that. So I can look at a person and I can say, okay, your T3 level is, decreased or elevated. Are you gaining or losing weight? That type of thing. But I need to look at what are you doing holistically? What is the whole picture? Are you sleeping well? What are those patterns? Are you, what supplements are you taking? So I think I hope that answers your question
It,
somewhat, but
it does.
um, I think that in medicine, and this is the thing, I want people to hear this very clearly. In medicine, um, long gone are the days of when a person walks into the doctor's office and says, "Hey, whatever you say goes." That day is
Yeah.
over,
Yep.
okay? Because there's Google, there's WebMD, people are more
Yep.
educated now, there's a lot more research available for people. So when people come in, they're very knowledgeable, which is
Hmm.
good,
Yeah.
right? So you have to work together with your physician or with your team. If you feel like, and here's where I'm going to empower people, if you feel like they're not listening to you or they're not really taking your needs seriously, then go find someone else. Find another
Absolutely.
physician that will. Find someone else
Absolutely.
that will, and that will work with you and that will listen to you and your needs specific and will look at you as a whole, like through a holistic lens. That's really important.
Absolutely. Look, we have so many topics that we're not going to be able to cover all the topics today. We have so many topics. We're already almost 40 minutes in, but I want to ask this one more question on the thyroid, and then we're going to look. You guys are going to want to tune in next week. We're working out YouTube live, and you're obviously watching this on a recording. But we're looking to have this live, but you can always watch the recording, and Tanya's going to be talking about stem cell research next week and how that's actually affecting people's fight against cancer. And again, it's quite amazing what she's got to say. But we're going to end this broadcast. I want to talk about high volume versus low volume, okay? So I want to talk about high volume versus low volume. But Tanya, one other question about the thyroid, all right? And this is a question that a lot of women ask, a lot of men ask. I have spoken to so many people who take the T4, and I think they have an underactive thyroid and it does nothing for them, and they use this product, and it's pig thyroid, and it's called Armour Thyroid, and they use it, and they get such benefit out of it compared to the synthetic T4. What do you think about Armour Thyroid, and are you aware of this particular compound medication?
I have. I've heard of it. I've heard different things in the medical field concerning it, pros and cons. Um, in regards to specific needs for each person, I think that again, I'm going to go back to individualized medicine. Each person is different. Each body breaks down things differently, and if that person is taking it and it's working, they need to be educated as far as the side effects or the consequences of taking that specific drug per se. But if as long as if it's helping them, um, you know, hey, go for it. But I would definitely be aware and make educated decisions. That's when I want to drive home, is that sometimes people don't make educated, well-researched decisions. And what I
Yeah.
mean is they'll just start taking this and that, and because Billy Joe said to take it. So my point being is, hey, if it's working, great, go for it. If it's not, then obviously that's a no-brainer. Stop it. But at the same time, you need to know what you're taking, why you're taking it, and the consequences of taking certain drugs. That's
Hmm.
very, very important. So, each person is different, and you need to be aware of how those things affect you and your body. I can't treat you the same as I would treat, say, Michael Smith down the street. You're
Hmm.
both very different. So individualized medicine is important. If it's working, I would say bottom line is if it's working for the patient, great. If it's not, and we're seeing good results, and there's no, harmful side effects that we're seeing, then, all for it. If there are side effects, obviously, again, that's a no-brainer. You're going to stop it, and you're going to make educated decisions.
Absolutely. Look, I was going to talk about low versus high volume. I'm going to save that for next week. I do want to announce this Thursday we have HIT Cardio Boot Camp taking place 8 p.m. EST. You can find all the details below this video on YouTube. If you're on Instagram, I have uploaded a picture which also has all the information on how you can take part in that. It'll be over Zoom. I'll be leading it. I also offer online personal training if that interests you too. Now we did say we were going to give away a superfood, and so the way to win that particular superfood from this broadcast, Tanya mentioned a particular type of cancer at the beginning of the broadcast. Email me, and the first person to email me that particular cancer that is correct will receive a free bottle of this detox superfood that is absolutely brilliant. Tastes like apple pie, and it'll make you glow. But I want to thank you for tuning in to the podcast. If you have any other further questions, my email is underneath this description. We are interested in answering people's questions, and we want to know what you want to hear. We want you to be entertained at the same time learn something. That's what this is about. Okay, so we want to learn what you want to hear. But one of these will be coming out once a week, and I'll be probably putting up a video on YouTube every day on gaining muscle, personal training, who knows what. You just stay tuned and subscribe to our YouTube channel. I guess if you're watching this, you're already an Instagram follower. If you're not, please follow me on Instagram because I post cool stuff. Because I am cool. All right. So it's been great, and God bless you, and have a good week.
Bye, guys.